Good morning. This is Senate Health and Welfare Committee, and it is February 4th. We are actually, today is it a celebration, Senator Hooker, for Heart Healthy Day?
I believe it is. Wear red.
Wear Red
Great day
Day.
to be shoveling if you're my age.
Yes, be careful when you shovel. Be easy on your heart. Good point. Okay, so this morning we're going to look at S91 and have our hopefully what is our final walkthrough, and then a possible vote. And we'll either vote after the walkthrough, or we'll wait till the end when other members of the committee are available. Then we'll look at S198, which is related to the Diaper working group and diaper needs in the state. That bill will have, and then we'll be looking at S206 with our healthcare advocate, Michael Fisher. He wanted to provide some information for us. So thanks all for being here. I think that maybe the weather has slowed a couple people down, but they should be joining the committee. And Katie, will turn to you, our ledge counsel. Thanks for being here.
Good morning.
To you.
Okay. Katie McLean, Office of Legislative Counsel. I'm going to pull up the most recent draft of S91 on your screens. Okay. So we should be looking at S91. This is draft 3.1. And what I've done is highlight the changes that were discussed during the last meeting. And so I'll walk you through those changes since you haven't had a chance to see them yet. So this is a strike all amendment. As you remember, the first section is definitions. When we last met, we added, or when we met maybe two previous times, we added a definition of core concrete supports. It's not highlighted because this is, I'm only highlighting the most recent changes. One of the most recent changes was adding a definition of secretary. If you remember, we sort of went around a bit about how to handle the designee issue. So we just dropped it into the definition that the Secretary of Human Services the secretary means secretary or designee. Then we have subsection B, and this had to do with how the network could recommend new parent-child centers for designation. And if you were to vote on this version, of course, the strike throughs would come out, but just so you could see the change, I've left the strike through in. So we've removed all three references to a designee because that's covered in the definition. And the committee decided to be silent on how often the network could recommend a new parent-child center. So the language every 6 years would be removed from this draft. Next, subsection C, if you remember, are all the different points or aspects of that a parent-child center would have to meet to earn designation or to be qualified for designation. So we don't have any changes there. Subsection D is the concrete supports. And there is a change in subsection D and the lead-in language. And this was a recommendation from the Child Development Division. So I want to give you the whole lead-in language. A designated parent-child center shall provide either directly or indirectly through formal community partnerships the following 8 core services. So again, that was added at the recommendation of CDD. And then we updated so I should tell you where I am. I'm in the funding section. And there's a lot of conversation when the committee last met as to how to incorporate this inflation factor. And so where the committee finally landed, at one point we had they shall implement this inflation factor. Then we had, they may implement this inflation factor. So sort of the needle that was thread here was this language directs AHS and its annual budget presentation to the Appropriations Committees, this committee, and Human Services to indicate the appropriation needed we're the agency to employ the annual inflation factor for the network. So this is sort of asking them to come up with a number every year as part of their annual budget presentation, even though it might not be part of their formal recommendation. And then we have our appropriation section. If you recall, there was some discussion about what to call the grant. I think one of the versions had master grant. So this language that the committee landed on was existing parent-child center grant, which I believe Nolan said is how it's phrased in the budget. And that is it for changes. So I will stop sharing and the committee can
Okay,
see each other.
there we are. Thank you. Looks good. Committee questions for Katie? Comments on the current draft? Okay. Well, I would, we've been through this bill several times, and Nolan, do you want to just briefly share with us the fiscal note so that we know what's included in the bill? And then,
Sure.
and after that, maybe we can entertain a motion.
Sure. I'm going to share my screen. And do you see that fiscal note?
We do.
Okay, so this is the draft, and it's not posted for folks watching. I will post it as soon as the committee votes on the bill, in which case then I'll post this so there's a fiscal note tied to the actual bill. So, but this is tied to the version that Katie just went over, which was draft 3.1. So, and by the way, you get to see our new fiscal note format that we're using.
Yeah, I noticed that. I noticed that the other day. It's very impressive. Very impressive.
More color, more flair. So I have a little summary, which I won't go through because Katie already went through. I provide a little bit of background, and I won't go through. Well, actually, I will a little bit. So currently, there's a base funding, the grant, and I just sort of say it's often referred to as the master grant or the integrated grant. The current base annual funding through that grant is $3.35 million per year. PCCs also get other money through DCF based on a myriad of services that they provide within their community. So they all get the money from the master grant, and then different PCCs have different contracts with DCF for different services based on the needs of those communities. So when people say, well, is that all the money that PCCs get? The answer is no, but this is the only one that they all get together. The rest has to do whatever services they provide. So I was trying to make that clarification. So section 1, as you know, this is where it requires the sort of the joint appropriation. And then it also has the annual inflation factor, which is just not required to go in, as Katie mentioned, the language that was indicate the appropriation that would be needed. So the agency would have to provide that information to, did we say who, to the legislature? Oh yeah, to the committees, but not actually provide. So just to give you a sense, for the 12-month period ended September 2020, that was 2%. And then for the 12-month period ended September 2021, it was 3.9%. And again, the annual factor that's in the bill was one, it's the employment cost index for total compensation for private industry workers in New England, as published by the U.S. Bureau of Labor Statistics for the 12-month period ending September for the most recent calendar year. And I provide a link to folks so they can see what that means and what that actually is. And from the conversations, that was one that was chosen because it's tied more towards employment and not other inflationary factors. Section 2 is where the appropriation is. So what it does is it adds 1.5 million again to the existing parent-child grant. The existing grant is 3.35, so the total base funding would now be 4.85. And then it has one-time funding of 3.7. So in the previous year, just so folks know, in fiscal year 2022, that one-time money in the budget specifically said for capital improvements, for whatever that means. So in this bill, it doesn't specify, it just says one-time funding. I believe it just says one-time funding. Yeah, it doesn't say specifically what for. So then below that, you'll see I've got a chart and I sort of lay it all out, sort of like a summary. So you can see the fiscal year 22, there's the 3.35 and the 3.7 for a total of 7. Then you see the Gov Rec. The governor has 3.35 million for base, but no one-time. So the PCCs would only be getting 3.35 from this grant. This bill would up it by 1.5. So it'd be total 4.85. And then it would have the one-time 3.7. So there would be a total of 8.55 million, which is an increase of 5.2 million above the Gov Rec. So that's the number that the Appropriations Committee is going to be focused on, is the increase above what the governor's recommended. And then finally, I just add a little note just saying that even though it talks about an inflation factor, it doesn't require it. So there's no fiscal impact tied to the inflation factor. And that's my fiscal note. Any questions?
Thank you. That's pretty comprehensive. Thank you very much. So I'm thinking that the Appropriations Committee will want to be looking at this quite thoroughly. And one of the things that I think we should acknowledge is that the bill will either remain in appropriations until we've completed our work and we can make recommendations on priorities about for health and human services funding, or it may well be struck and then we would have the bill without the section 2, which is the appropriations fiscal note piece that's the 5 point whatever million dollars over the budget. So just to acknowledge that we have felt that this is an important bill, and we have wanted to support our parent-child centers, but that it falls within a broader context of need and our decisions as we go forward when we take up our considerations around the big bill. So just wanted to remind ourselves of that. Senator Hardy.
I just wanted to ask if we could advocate for having the bill move forward, even if they need to take the appropriations out, because the language itself isn't tied to the appropriations, and it would be nice to get this moving, given that it's been several years in the making, and we can make that change without messing around with the appropriations.
Well, that was the intent of my comment, that the Appropriations Committee will have two choices, and we can advocate for one, which is to please move the bill along on the policy sections. So that's a very good idea. Senator Cummings.
Just listening to you and having listened to all the mental health people the other day who need a 10, not a 3%, just to hold on to the few employees they've got left. Are we setting ourselves up by sending this out and saying, we want you to give $1.5 million more to the parent-child centers, and then when the big bill comes to us, are we setting ourselves up so that we aren't going to be able to advocate for mental health agencies because we've already advocated to spend the money on parent-child centers? And maybe it'll make us feel as the appropriations people feel, but is that what we're doing?
That is exactly my point, that there are a significant number of needs that we're hearing about. And it begins with parent-child centers, mental health issues, those with aging and disabilities issues and home care, all the things that we've been talking about. And so at some point, we're going to have to decide on priorities. The fact that this bill has been in the works for a couple of sessions, and that doesn't mean that it has a priority, because mental health has been in the works for a couple of sessions as other issues. So I guess the comment that I would make, Senator, is that this committee needs to agree that as we talk with appropriations, we let folks know who are very interested in this bill, that as we talk with appropriations, this recommendation is going to be a part of any other recommendations that we make. And this committee is going to have to set priorities on that. We cannot push everything over. I was going to say dump everything on appropriations. We can't do that to them. It's really unfair. So we will do as we have in the past, and we will put this into the broader group and try to make our decisions. We've done a good job on that in the past. And I don't want appropriations to feel that just because the bill is the first bill out with the first appropriation, it's at the top of the list. It may well stay there. We don't know. So we have to look at everything. If the committee agrees with me on that, I'd like to know, because that's the way I've been thinking about it. And I think Senator Cummings, you've expressed it very well. Go ahead. Discussion time. Go ahead, Ruth. Yep.
I don't think just because it's the first bill out, they're gonna, they understand that how bills move through committees. And this was a bill from last session that we took up early because it was sitting there. And we obviously have a lot of issues in our area that we'll have to prioritize. And we can make a whole table. I love budget tables.
It's all yours, all yours.
I'm happy to do that, and we can have that conversation and put this on there with all the other things that we need to prioritize. But I think that holding up the bill just to wait.
I'm not. Yeah, no, good. Good comment. I'm not suggesting we hold the bill up. I'm just saying that we agree that it's the first bill out. We very much would like to see it fully funded. But we have a lot of other things we'd like to see fully funded. And so we're going to have to set that into context when we make recommendations to appropriate.
Absolutely. And I think our appropriations committee is highly experienced. So they'll get it.
Yeah, and Senator, you're right. They do get it. But there are folks who are listening in or watching in and who may not understand the process. And we want to be very clear about what we understand and what appropriations understands going forward. So
absolutely. I just want to make sure that the policy can move forward, and that we can have the conversation about money later when we need to, but the policy is important too. So thanks.
We're good. Okay. Any other comments on this? I think we get it. We understand the policy piece. We need that. And the parent-child centers have requested that. And the money is important too, but we'll have to put that into the list going forward. So unless there's further discussion either about the policy piece, the changes that Ledge Council has presented to us or other, I would accept a motion.
I move that we pass S91, trying to find the draft 3.1. Is that all you need to say? Oh, 3.2? Oh, 3.2.
I'm sorry. I've updated it because the 3.1 has the strike throughs and the highlighting. So it's the same draft, but you're voting on 3.2, the cleaned up version.
Okay, thank you. 3.2.
Okay, so the motion is that we vote to forward draft 3.2 to the full Senate.
Do we need a second?
Senator Clerk, any further discussion? Okay. It's all yours, Senator Terenzini.
Okay, at this time, I'll ask for the roll call vote for S91 version 3.2. Starting with myself, I'm a yes. And Senator Hooker,
Yes.
Senator Cummings,
Yes,
Senator Hardy,
Yes.
Senator Lyons.
Yes,
I have a vote of 5-0-0.
terrific. Well, thank you all. Is there a reporter? Would someone like to report this? And it will mean representing the committee position in, as we've discussed it, in appropriations, should that be necessary.
I would like to report it if that's okay. I know I just reported a bill, but if
Well, let's yeah, no, I thank you, Senator Hardy, and let's just make sure that, Senator Hooker, are you interested, or Senator Cummings?
I think this is Senator
All
Hardy's.
shaking your heads no. Okay, no,
I vote
I'm
for
fine.
Senator Hardy.
I'm fine with that, Senator Hardy. So that
Thank
would be
you.
good. Yeah.
Thank you. And I will be sure to represent our position about the budget stuff to the Appropriations Committee.
On this bill. That's good. Okay. So next steps then are for you to have the clean copy from Katie. And then what else needs to, and the vote, what else needs
You'll
to
just
go?
send that to me, Katie, since I only have the
I
yellow
just
one.
did.
Oh,
Yep,
you did?
got
Oh,
it.
perfect.
Yeah.
I also just got an email that says, "Hello, Prime Minister" on it. Did you all get that one too?
I haven't been promoted yet. Maybe you got promoted.
I'm
I was
checking.
like, what?
I think they mixed you up with me.
Oh, okay. I'll forward it to you, Ann.
Wait, I'm looking. No, I didn't get one. Oh, well. I
All
guess
right.
you're it.
So this is so exciting that we're looking at email. Not good. Okay, let's move along. Katie, thank you. Is there something else that we need to do from your perspective on this one?
Nope, you should have it in your inbox, so you should be all set now.
Thank you. All right. So that was a good discussion, and I think it will serve us well as we go through other bills that have appropriations and similarly. Let's move on to S-198.
What?
That was
Wait,
my fault. I was trying to hit something and I did that by accident. Apologies.
are we live now?
No. It's
We're
paused.
live.
Aaron, you can fix that. Sorry.
Okay, we are still on YouTube.
Okay. I hit the recording button by accident. I was trying to.
It says
leave.
recording pause. What does, there we
Yeah,
are.
sorry
Okay,
about
that's-
that.
Okay,
My apologies.
We're good.
we're all good. We are definitely good. Okay, so we're moving on to S-198, and it's an act relating to diaper need working group. And I think some of you have been getting emails about the diaper distribution that we provided. I think it was $50,000 last session to cover, help cover diaper costs. And then the distribution went through the food banks. And I've been getting messages from my local food banks and others about the effectiveness of that. But so let's go through S-198, and then we can decide who we need to hear from on this particular bill. And this morning, we're very fortunate to have Rosa Reyes here. And Rosa, we're going to introduce ourselves to you first, and then we would like for you to introduce yourself. And actually, Katie will introduce you first. So we'll go in that order. So I'm Senator Ginny Lyons, Chair of the committee. Ruth?
Good morning, Rosa. Thanks for being here. I'm Senator Ruth Hardy from the Addison District.
I'll go.
Right.
Good morning, Rose. I'm Ann Cummings. I'm from Washington County. I'm sitting in Montpelier, not in the State House.
Hi, Rosa. I'm Senator Cheryl Hooker from Rutland. Welcome.
Good morning, Josh Terenzini, Senator from Rutland County.
Terrific. Katie, would you like to do the introduction, and then we'll have Rosa introduce herself?
Sure. So we're lucky to be joined by Rosa Reyes this morning. She is a 12 student at Vermont Law School, and she is doing the legislative clinic this seminar with the Office of Legislative Counsel. So she has been working with all of the attorneys in our office, and she has prepared a walkthrough of S-198 for you this morning.
Thank you, and thank you for bringing her to us. This is great. Rosa, it'd be great if you could just give us a thumbnail sketch of you and introduce yourself, and then we would like for you to walk us through S-198.
Thank you for having me, and thank you for the introductions. My name is Rosa Reyes. I'm the Vermont Law School student clinician with the Legislative Council. I've actually lived in Vermont for a couple of years now. I moved here before I started law school, so I live in St. Albans actually, and I really love the state.
But you're in St. Albans now, I hope, and not driving down the interstate.
No, I'm actually in South Royalton right now.
Oh, okay.
My husband lives up in St. Albans now. I live next to the law school.
Oh, good. Okay. Save you a drive. Oh,
Thank
thanks
you.
for being here. And why don't you go right ahead to 198?
Sounds good. Thank you for giving me this opportunity. I do greatly appreciate it. So I will be introducing S-198. This bill does create a diaper need working group. And we'll start off with the general findings for the proposed general findings of the assembly. So there are over 17,000 Vermonters that are under the ages of 3. 24% of the Vermonters under the age of 3 live in families that are earning 100 to 200% of the federal poverty level. Most child care facilities require parents to provide diapers for their child. And during the COVID-19 pandemic, funding was allocated to support the purchase and distribution of diapers to Vermont food shelves. So to go into section 2, subsection A is the creation of the group. So it's the diaper need working group is created to study and provide recommendations on the best way to provide diapers to families with low income in Vermont to alleviate that diaper need. Section B goes over the membership of the working group. There would be 2 current members of the House of Representatives, not from the same political party, who shall be appointed by the Speaker of the House. 2 current members of the Senate, not all from the same political party, who will be appointed by the Committee on Committees. The Secretary of Human Services or their designee, the Commissioner for Children's and Families or also their designee, the Commissioner of Health or designee, an employer volunteer or representative of the Vermont Diaper Bank appointed by the Speaker of the House, a representative of the Vermont Food Bank, Food Shelf or Food Pantry appointed by the Committee on Committees, a representative of the Parent-Child Centers appointed by the Vermont Parent-Child Network, a pediatrician that is licensed, two parents of an infant or young child with low income, at least one of whom does identify as Black, Indigenous, or person of color. Subsection C goes over the powers and the duties of the working group. So they will study and make recommendations concerning how to best address the need, the diaper need that is experienced by families in Vermont. And the goal is to alleviate that need. The working group will address the scope of the diaper need in Vermont, the most efficient and appropriate method of diaper distribution to families experiencing diaper need, and the potential fiscal impacts of addressing diaper need in Vermont and the appropriate sources of funding. Subsection D goes over assistance, which is the working group will have the administration, technical and legal assistance with the Department for Children and Families. Subsection E goes on to the report, which is on or before December 1st, 2022. The working group shall submit a written report to the House Committee on Human Services and the Senate Committee on Health and Welfare with its findings and recommendations for legislative or regulatory action. F goes into the specific meeting, so the Commissioner for Children and Families or their designee will call the first meeting of the working group to occur on or before August 1st, 2022. The working group shall select a chair from among its members at the first meeting. A majority of the membership will constitute a quorum. The working group will cease to exist on December 1st, 2022, or as the previous section mentioned, whenever the report is due is when this group will cease to exist. Subsection G goes over into compensation and reimbursement for attendance at meetings during adjournment of the General Assembly. A legislative member of the working group serving in the member's capacity as a legislator will be entitled to per diem compensation and reimbursement of expenses for no more than 8 meetings, and these payments shall be made from monies appropriated to the General Assembly. Other members of the working group are entitled to per diem compensation and reimbursement of expenses, and these payments shall be made from monies appropriated to the Department of Children and Families. Subsection 8 goes over into the appropriation. So the sum of $7,000 is going to be appropriated to the General Assembly from the general fund in fiscal year 2023 for per diem compensation and reimbursement of expenses for the legislative members of the working group. Will also be given pursuant to the section in the Vermont statutes annotated. And the sum of $6,000 is appropriated to the Department for Children and Families from the general fund in fiscal year 2023 for per diem compensation and reimbursement of expenses for members of the working group. Section 3 goes into the effective date, which it shall take effect on July 1st, 2022.
I was muted. Let's ask questions about the bill itself. Rosa, in terms of the appropriations that you have listed there, is that I'm trying, you won't know you may not know the answer to this. You may have to phone a friend, but so the appropriations, is that the usual way we do it, for example, for the folks who are not legislators? And then
I will defer this question to Katie, so she'll have a better understanding.
good. Yeah,
Sure.
it's
So
okay.
it's the standard language for per diem and compensation. So you have it divided into 2 parts because you have a legislative appropriation for legislative members, and then you have members who are not legislators and are not doing the work as part of their ordinary job. And that's the second part. The appropriation is maybe bigger than what you normally see because you'll notice that it's approved for 8 meetings, which is sort of
A lot.
tends to be a little bit on the higher side of meetings for a 1-year group.
Yeah. Okay, and that was what was striking me, was the amount. I didn't know whether we always had the amount in there, so. Okay. Rosa, in your work on the bill, did you do any sort of look into the current situation, the current diaper program, and as it's working? Did you have a chance to do that or not?
Yeah, so I did get the chance to look into it, and from what I see, it is working so far, but there are always going to be families that are missed or that are not always touched on. So I did do research to see what other states were potentially doing. Some states decided to no longer do a tax on diapers like they would on feminine products as well. Others give a certain amount of diapers once the child leaves the hospital and things like that.
Okay, Senator Cummings.
In my long tradition, I'm going to throw a curve in here.
Uh-oh.
There's getting diapers, and then there's disposing of diapers. For those of us that grew up with cloth diapers, that
It's
wasn't an
washing
issue.
diapers.
It was washing diapers. But my son lived in Toronto when his first child was born, and they recycled diapers. He thought it was the greatest gift to mankind since sliced bread. And I'm just surprised Vermont's never looked into it. They were composted along with other organic waste, and then you could go get your bucket of compost from the city. But I'm just wondering, nobody here seems to have talked about that. And if that's something this diaper group could look into.
Good suggestion. Very good.
That's definitely an option. It is up to the committee. They could hear testimony on which parents would prefer as far as cloth diapers or just the standard.
Nobody wants cloth diapers.
You never know. They might, for sure. But yeah, it could be something that could be looked into by this working group.
So in your review of other states, so you mentioned removing the tax on diapers as we have done for feminine hygiene products. How many states have done that?
From what I saw, about 3 or 4, so not very many, but it is gaining a bit of traction as far as doing away with the tax on diapers.
Are there states around us that have done that?
Rhode Island.
Okay, so there's one.
Okay, so because when I asked when we were doing the feminine hygiene products and I was looking for a comp, I was told we did not tax adult diapers. I didn't ask about baby diapers. So that would be something to check.
Yeah.
Yeah. Sorry.
Who?
Actually, Senator Terenzini's had his hand up, so I'm going to defer.
Wow, Senator Terenzini.
Thank you.
It disappeared next to that gold dome.
It's floating.
There's the gold dome's gone now.
There you go.
No, I was just you already picked up on what I was gonna say. It would make a heck of a lot of sense to me that we wouldn't tax, once again, a product like diapers, which are, a necessity in life, just like what we did last year with the what's the technical term?
Feminine hygiene.
Feminine hygiene products. Once again, it seems like what I like to call a no-brainer, that we wouldn't want to tax something that's sort of a necessity of life. And if you don't believe diapers are a necessity of life, I invite anyone to come over here today and see for themselves. But to that could be something we could incorporate into this bill and ask them to look at. And yeah, all right, I'll leave it there for now. Thanks.
Okay, so is there, Rosa, can you look and see whether we have a tax on diapers, baby diapers?
Yeah, I'm more than happy to do that.
Terrific.
Can I ask?
Senator, I know, who was next? I saw 2 hands up. I saw
Senator Hardy, you had a.
Go ahead,
had
Senator
a-
Hooker, and then Senator Hardy.
Okay. I'm just wondering, Rosa, if you've talked to people from Burlington. I believe there's a diaper bank in Burlington. Is that
There was.
something that anybody is aware of? I know that some people from Rutland worked with them in trying to establish a similar setup here in Rutland. So
Well, yeah, the Junior League has been in charge of the diaper bank, but we'll have to bring some testimony in on that. We'll get the person who asked to have the bill introduced in the first place was a member of the Junior League Board of Directors or president of it at one time.
Okay, that's good.
But we'll bring the diaper bank in. I don't know what the relationship is to the Junior League, if any.
Mhm. And with regard to Senator Cummings' comments about recycling or disposing of the diapers in a composting way, and there are and I haven't had diapers in my family for a long time, but there are types of diapers that have kind of inserts, and you can dispose of a certain part, because it seems to me that the disposable diapers have a lot of plastic and the like. That
You will recall that, maybe you won't. I can't remember how many years ago we eliminated the flame retardants and some of the other nasty little chemicals from baby diapers.
Mhm.
So in this state, we shouldn't have any of the
No,
bad
but there
chemicals.
are plastic liners.
And they do have plastic liners, but they're non-toxic theoretically.
Theoretically.
Anyway,
There's a lot to learn about diapers.
yeah, well,
I'd hate to ask what was in rubber pants.
yeah. Rosa, is there anything else that you have for us that would help us going forward in terms of looking at why this bill is necessary?
So I did just look up your question while there was discussion. So Vermont doesn't tax on child and adult diapers and cloth diapers. They don't tax on that either.
Oh, good. Okay, so we're
Okay.
good with that.
Yeah,
Okay.
I was looking that up as well and was gonna let you know that.
Good.
Because I remember that, Anne, when we went over, and it's menstrual products, not feminine hygiene products. We're gonna change that.
Whatever. It's good.
And if you see, we're considering that, it is really the corporate income tax rewrite. We are not spending hours on feminine hygiene products.
I know.
We're
I
gonna
know.
change the corporate tax to the feminine hygiene tax. That's what we're gonna do.
Oh,
Anne and I need a really good laugh right now.
Well, it's
we won't even
Friday.
talk about taxing timeshares.
It's Friday. Okay.
I well,
Go
so
ahead, Senator Hardy. You
yeah,
had,
I was looking that up when I'm totally in favor of trying to figure out how do we get diapers out to people who need them, and to figure out things like composting diapers, etc. I think this working group is overkill by a long shot, and having legislators and the secretary and all these people on a working group and spending $13,000 to meet 8 times to figure out how to get diapers to people is totally overkill. So we just did a bill on parent-child centers. We've talked a lot about childcare. We gave $6 million in the budget adjustment to the food bank. It seems like we already have institutions and mechanisms to get diapers out, and we just add them to the things that we already are doing and saying, child care centers shall use some of this funding to provide diapers. Parent-child centers shall do the same. The food bank shall do the same, or whatever. But having a working group that spends so much of people's time, when people's time is precious and staff is short and we have so many big issues to tackle, just seems excessive to me.
so, and in the communications that we're getting from the food banks, the local food banks, there's a enthusiasm for continuing that distribution. But then we will take just a little bit more of testimony on this so we can determine if and how and what is needed to get to a decision. But one of the questions is about income levels for distribution, and should everyone be getting free diapers? These are questions, and I'm not looking for answers. This is some of the things that I've heard. Should the diaper distribution go through some kind of a reach up eligibility determination? So and should there be an executive director for distribution? So we can hear we can hear from people on this bill, and then we can make our decision about how to proceed. But there are some people with some very real and passionate concerns that have driven the request for the bill. So we'll at least look at it to begin, and then we'll take testimony on that. We have, that's right. We have, trying to remember, Charity Clark, who was, I think, the past president of the Junior League, and Amanda Hertzberger, who's also involved with this, will be here Tuesday morning to talk about the bill and give us an understanding of why it's an issue, why there are issues embedded here. We should do that. Because we don't want to stop distributing diapers, but we don't want it to become a some kind of a burden or whatever. Rosa, anything else we need to hear from you? Cheryl, did you have your hand up?
I just wanted to say that, I know I'm a co-sponsor of this bill, but I agree with Senator Hardy that it is overkill. I mean, this working group is huge, and I wish we could just put the diapers in a place like the food banks or the food shelves, and just let it go forward. When I was volunteering at the local food shelf, people who needed the diapers were very glad to have them there, and they came and they got them, and people donated them when little ones like Senator Terenzini's outgrew or no longer had a need for diapers. They would donate their extra diapers. People would donate diapers, as a matter of course, and they were always a hot item at the food shelf. So it's a good place to distribute, and I'm willing to listen certainly to people who have more expertise in this area to see where we can shore this up so that more people are they're available to more people. But
we don't know what we don't know, but on the surface it feels like the distribution process has worked very well. We do need to understand what concerns may be out there, so we'll do that on Tuesday and then make a decision about how to proceed. Okay. Rosa, anything else we need to know at this point?
Yeah, I just wanted to correct myself. I said Rhode Island was the ones that did tax exemption for diapers for children. It's actually Connecticut.
They're close by. They're right next door to each other.
Yeah,
and they're still in New England. Okay.
That's about all I have, though.
Yeah. Okay. Thank you. Thank you for that. All right. So, but the composting issues is something to sort out. That'll be another issue. All right. Well, this is good. Rosa, thank you for being here. And we're going to take a little bit of testimony on Tuesday just to sort out whether or not the working group is actually needed and what we might want to do with this bill, if anything. So appreciate your time very much and the effort that you've taken to research what other states are doing. And then on the spot, the tax issue. Thank you. We're good.
Thank you for having me. Greatly appreciate it.
We'll see you next time, I hope. All right. So committee, I think that we'll thank you, and we'll move on, I think, and hear from Mike Fisher regarding S206, which, as you know, is the cognitive impairment bill that we worked on the other day. And just as an FYI, and Ruth has volunteered to work with Katie to give us an update of the draft, and hopefully we'll be able to include as much of the testimony that we heard so we can make decisions about a new draft going forward. So that's good. So Aaron, I think we can move to Mike Fisher. You think he's available?
Good morning. I'm sorry,
Good
I just got on.
morning. Good morning, Mr. Healthcare Advocate.
Good morning.
Michael, thank you for being here. So you had indicated an interest in S206, and we've been working on the bill a little bit, hearing testimony, and we've got we're going to be putting together a next draft, but your input, I think, will be very important to us. So do we have testimony from you?
Thank you, Senator. I don't have written testimony. I really wanted to use this opportunity to emphasize a point that you heard the other day. I listened to your testimony, and I should say out loud, I'm Mike Fisher, the healthcare advocate.
Good.
And I have felt for some time that there was a policy issue related to this bill that was not receiving the amount of attention that it deserves. You heard earlier in the week from the Hospital Association that there were 113 people awaiting placement, and a perspective that about 20% of them may have Alzheimer's, and a recognition that there are indeed workforce and federal regulation issues related to this issue. I want to say out loud, I'm the healthcare advocate, not the long-term care ombudsman. The interaction between the advocate's office and long-term care issues is an interesting one. My viewpoint of this issue is both as a party to the hospital budget process, and through our helpline as we try and help families negotiate or manage this transition from a hospital bed to a long-term care facility. So I think there's a real similarity between this issue and the issue of people waiting for placement who are in a emergency department waiting for a psychiatric placement. There's a similarity. In both cases, we have somebody in the wrong facility, not getting the care they need, the level of care they need, and there isn't a placement, and there isn't a placement for the care they need. Members, senators, you know this. I've been working on healthcare policy for a lot of years, and we've been working on the tremendous needs of people waiting for psychiatric placement forever, since before the closing of the state hospital. And I just feel like this is a similar one. And Senator Hardy?
I'm sorry, Mike, are we taught, you're listed under S206. Is that, sounds like you're talking about a different bill.
No,
or maybe I'm just not understanding.
I think he's making an analogy between what's happening with people waiting for Alzheimer's care,
Right.
or cognitive impairment care, and what we're seeing with mental health issues
okay.
for step down beds and crisis beds. So
Right.
the
I am,
availability of beds outside of the acute care setting.
right. I am making an analogy.
Okay.
I am just
I'm
recognizing.
sorry. It wasn't clear to me where you were going, so I thought maybe I was misunderstanding the bill you were addressing.
Yeah. I am making an analogy. I am just recognizing a similarity. And in both cases, it's the wrong care. And in both cases, it is costly on our system. And we see cases where people are waiting for long-term care facility placement who are hard to place because they have a history of violence, or because they have drug addiction issues. You try placing somebody who's on medication-assisted treatment, or who even who have a history of a criminal record. And so I really wanted to just take a few minutes of your time to emphasize that that I believe this is a structural problem that's bigger than just, and I am sure that workforce plays tremendously into this. But I believe this is a bigger issue than just workforce. And I don't believe that it has received the amount of public policy attention that it deserves. And so I really wanted to jump up and down a little bit and say that this is a big deal that's putting a real stressor on Vermont families and on Vermont hospitals.
Yeah, no, thank you. And I think as we were talking through the bill, we recognize that there are very few places where these patients can be sent once they're diagnosed or in the acute care facility. So I know in my district, as I said the other day, there's one, maybe two, but they're full. And so the result is we don't have a place for the people who need the care. And this is analogous to what we're seeing with the crisis beds and the step down beds for mental health folks. So, I mean, you have really pinpointed something that is an institutional issue and requires significant resources. I don't know that we're going to be able to solve that problem within the bill itself, but perhaps there's a way that we can identify the problem within the bill and ask for some further work. So, yeah.
That's exactly right, Senator Lyons. I think I'm not suggesting that you're going to solve this problem in this bill, but
oh, thank you.
But I do think that if this bill can serve as a part of a launching, to make sure that we understand the full dynamics that lead to this, so that in the future we can take steps to address it.
Well, it will be interesting also, and I don't know whether you have looked at the plan, our older Vermonters plan that has been developed and is, I don't know if it's finished or not, but what comments, if any, are there within that plan? And you also bring up a very good suggestion about bringing Sean Lonergan in, our long-term care advocate, in to talk about this bill. And so we will, Aaron, that's a note, we'll do that. That's very helpful. Senator Hardy, you wanted to comment or question?
Sure. I remain slightly confused, but I have a lot of bills in my head. So, Mike, if this bill could be a launching off point for that conversation, can you suggest some language most of the bill is about planning, and so perhaps there's language to insert about planning, about placement planning or whatever. So if you can send me and Katie,
well, if you send it, you'll send it to the committee.
Sure.
To
well,
Aaron.
we're going over the bill on Monday,
Right.
Katie and I.
Oh,
So,
I got it. Yeah, well,
yeah,
make copy
yeah.
everybody, copy everybody.
Yeah,
So,
whatever. However, whoever you want to send it to, but we're going over the bill on Monday, and if you have language, we can consider it next time we look at it.
The other thing, the thing that I suggested, and before we finish the conversation, I think we need to hear from Sean Lonergan. And then we also need to look at the older Vermonters plan that we have and see what's in there. Those two things, I think, will help us complete the circle on this. And so,
yeah. I want to emphasize again, my vantage point is particularly
yes.
watching the hospital budget process.
Yes.
And the cases that come through. I'm not, for all I know, there's a lot of people thinking about this issue. I don't, I don't hear it receiving the level of emphasis that I think it deserves, and I see its pressure on Vermont hospitals. So,
well, yeah. So we need to sort that out. You're absolutely right. It's a very difficult situation, especially for the families of people who need this care.
Yeah.
Anything you can send us in writing would be helpful.
Yep.
And
I'll
then
take a look at that.
Perfect. Thank you. And thanks for thinking this through with us a little bit. Appreciate it.
Have
All
a
right.
great Friday.
It is. It's Friday. And committee, we're going to take a little break. And then we're going to come back and look at gubernatorial appointments and perhaps have some time for discussion.